Can you remember when and why you decided to pursue a career in the healthcare sector?
I was in secondary school and my friend's mum was a nurse, and I decided that nursing would be a good career to have with a family, and I really wanted to have a family, so I went and studied to become a nurse.
What's your current position at TDHS and what was your pathway to the role?
So at TDHS I am a diabetes educator, and I started last November, and my nursing background led me to this role. I'd been a district nurse for about 20 years at Lismore, and a lot of new medications and technologies were being developed and I wasn't really familiar with them. So my daughter, who was also studying to be a nurse at the time, suggested that I do further study. So I enrolled in Flinders, South Australia, and became a diabetes educator. It was a year part-time online and with 3 weeks face-to-face in South Australia, and then a placement at a healthcare facility.
Why do you enjoy working in the healthcare sector in Timboon?
I came to Timboon because it's a great health facility. It's got a multidisciplinary team. It's probably the envy of all little towns really, to have your urgent care, your acute care, your aged care, your allied health. You've got your social work, your diabetes education, your dietitian, your exercise physiology, your physio. You've got your home care, you've got the social support group. It's just a great facility, and I love working in that multidisciplinary team where you can all work together to get the best outcomes for people. Yes, and we've got the GPs just next door, so you couldn't ask for more. It's a lovely drive down to Timboon, a lovely little town, lovely shops. You can go for a walk at lunchtime, and the gardens in the healthcare facility are just beautiful, so it's a really nice place to work.
Explain a typical day for you at TDHS.
So I arrive in the morning on a Thursday usually, and I have a look in my diary and see who's booked in for the day. So people can refer themselves by just ringing Timboon, and I'll be left a message to make contact with the person, or the GP or the local hospitals may refer people as well. And then people come for all different reasons. So you might get the newly diagnosed person with diabetes just looking for information. Other people will be wanting to replace their meters and have some explanations for the new technologies that are about. Some might be commencing insulin and other injectable medications and need education. Other people come for their annual review, and this is a good opportunity to reflect on their management. Is there anyone else here that can support them, whether they might want to join one of the new exercise physiology classes when they're running, or whether they might need a bit of extra support from social work, whether there's new medications out there their GP might be able to discuss with them and would be improve their management. So yeah, there's lots of reasons why people come.
What would you say to someone thinking about a career as a health or care worker?
So I would recommend anyone who's sort of a caring spirit, or even people that have got a great sense of humour, are great for the health industry. There's lots of variety. You can take your skills from one place to another. You can work in all different states, and you can work in the city or you can work in the country. If you train in one area, you can transfer your skills to another area. It's great to be able to care for people in multiple settings, so I'm able to do home visits, or people can come into the centre, and there's nothing better than looking after someone in their home, keeping them in their home and supporting them and their family in getting the best health outcomes they can.